Younger men are turning to testosterone replacement therapy, or TRT, in hopes of building muscle and improving their quality of life. But there are some risks that they might not be considering.
As you see, 9 News health expert Dr. Palacoli is joining us at the desk to talk a little more about this. Let's first talk about TRT. Set the stage. What is it? Why is it becoming popular?
I mean, it has taken off in popularity like there's no tomorrow. I remember when I was in training, nobody did this, but I think it's really the perfect storm of factors. So we look at social media influencers that have really started promoting this wellness culture, this longevity, yes, building muscle and faster recovery. We look at kind of a focus on men's health more than ever before. And then we look at people looking for something to blame. We know that as a generation, we're more tired, more fatigued, more stressed out, have more mood swings, have lower motivation. So put it all together and it's the perfect storm. But if you think about it, testosterone is supposed to go down as we age. So generally after the age of 30, Phil, you start to have your testosterone levels go down.
Why'd you say Phil?
Okay, first of all, men can still have babies well past women. So where?
And so the point is that even though you're
feeling uncomfortable,
even though you decline 1 to 2% a year, it doesn't start manifesting as disease until your 70s or 80s. So young men should really not be taking testosterone replacement unless they have something called hypogonadism, where the testicles are just not making any testosterone.
So how is it diagnosed then? Is it blood test or is it?
So it's a combination of 2 things, symptoms combined with a blood test.
Okay.
But here's the tricky thing about testosterone. It goes up and down during the day. So it depends on what time of day you check your testosterone. You generally want to check it in the morning, and then you want to confirm it with the second blood test. And if you do happen to find a young man in his 20s or 30s with very low testosterone, that's usually a medical problem. He could have a brain tumor. He could have some other problem with his testicles. So you then have to look for the why, because it's not normal for young men in their 20s and 30s to have low testosterone.
I'm sure, like with anything, there are misconceptions. People believe that testosterone boosts male fertility. Is it a misconception? Because there is this manosphere out there. We've talked about it before. And there are these folks online telling young men specifically that they need to be strong and virile and, conquer women and all that stuff. Like this has something to do with it, doesn't it?
This is what we think of when we think of testosterone, but it is a total misconception because in fact the opposite happens. So the way that it normally works in young men, our brain tells the testicles to make testosterone. When the body sees a lot of extra testosterone, the brain says, I don't need that testosterone anymore. Let me turn off the testicles. The testosterone production, the native testosterone, declines. The testicles can atrophy or shrink, and a lot of times this is not reversible. So sometimes when you stop the exogenous testosterone, the testes wakes up again and starts making that hormone, but sometimes you're left with infertility, low sperm count forever because you've actually shut off your body's natural mechanism.
So you have the opposite effect of what people are talking about.
Yes, and so testosterone levels are high, but fertility is rock bottom, very low.
Okay, so first of all, I wonder how you can get this message out, because some people are getting it through some like underground clinic kind of thing, right? Is that what they do?
Most young kids are actually. They take these supplements or they take these injections. Now, of course, you can get gels, but prescription, most doctors will not give men in their 20s and 30s testosterone. There's really no medical indications for doing that unless they have that hypogonadism. So yeah, they're getting it in the black market, and we know it has a lot of risks, right? Testosterone, heart risks, it increases the thickness of the heart with potential cancer risks. Obviously risks of blood clots because it makes your blood thicker. It can increase your risk of sleep apnea. We talked about fertility, but even cosmetic risks. So paradoxically, people think, as you said, Phil, testosterone makes you virile, makes you strong, makes your muscles bigger. It can cause more male pattern baldness. It can cause severe acne. It can cause all other types of cosmetic
That's ironic.
problems.
You're saying it can do the absolute opposite of what the manosphere is telling these kids it can do.
The manosphere is
all
trying
right.
to do.
That's why we clear things up with you, Dr. Coley. Thanks so much.